Hey guys, welcome back to my channel. Today we're going to talk about Dr. Pen A6S for micro needling. I'm going to take you guys on a small journey about micro needling and the parts of the body that needs to be micro needled. So Dr. Pen is an amazing, excellent pen. It has a cord just in case you want to plug it in. If you want to use it with your electricity, you can go ahead and plug this right in and use it. This needs to be plugged in to be used, or you can use the battery. I love this because I can travel with this without worrying about where to charge my phone, especially when you travel in different countries that uses different electricity, 110 voltage and 220. So I'm always on the air. So here is the battery, and the battery is charged already. Let's go. It's on. You can see the blue light. It is on to be used, and it's already at 2. Anytime you use this, it's already preset. So the last time I used it, it was on 2. And then here is how you charge your batteries. So this entire box comes with 2 batteries. So this is the first one. This is the second battery. And for you to charge your battery, just in case you finish using it, and anytime you charge your battery, it lasts for 4 hours. For you to charge this small piece here connects to the battery, and you plug this in, and it goes in the socket to be used. So this is the whole great thing about Dr. Pen. I love Dr. Pen. I love using my Dr. Pen. I did my face a few days ago, and I forgot to take you guys on a journey on the process, but I did not do my lips. So today I am going to walk you through on how you can microneedle other parts of your body. Many a time we tend to forget that we don't only age on our face. We age around our eyes, we age on our neck, we age on our décolleté, we age on our hands and our feet. Those are the immediate signs of aging that people get to see right away. So today I'm using a cartridge of 16. So my cartridge is 16. This cartridge has some fine needles. And before we get started, so to do the lips, first thing you want to do, make sure, because I'm doing it on myself, make sure that your hand is sanitized. Okay, I sanitize my hands. I use alcohol swabs. We age on our lips. It's a little bit stingy. We age on our lips. We tend to lose our melanin production on our lips. And that's why when you're getting older, your lips are also getting thinner. So I am going to use the numbing cream on my lips. And I'm going to leave it for about half an hour. So after half an hour, guys, my lips was like closed for cool half an hour. I don't want this to get inside my lips, but I'm still going to use this to wipe inside just to make sure I don't swallow that. So we are going to work now. I'm putting this at 4, okay? And yeah, speed is 4. And I have this set at, speed is at 4, and the needle is set at 0.25. Feel free, depends if you have big lips already, you can go all the way to 0.5. It's entirely up to you. But today I am using the tiniest, the smallest, 0.25. We're not going to go in a circular motion because we are going to treat the lips. The lips is long, this way, like oval. I'm going to do this side too because I'm having some dimples here already. I have hyaluronic. I have some hyaluronic acid. So I'm going to place it around on my lips and around my lips area. So speed is 4 and the needle is 0.25. See some redness, there's some bleeding already, and that's exactly what we want. Puncture the skin a little bit to induce collagen production. So I can see the redness, my lips. Honestly, when you do this, you don't really need to have a lip filler. This will induce collagen production, and within time, you will begin to feel your lips begin to plump up. Guys, please, if this is your first time, subscribe. I shall be taking you guys along on everything skin. Thank you, guys.